Hello and welcome back to our YouTube channel. My name's Neil Cain. Today I'm going to be talking to you about potentially a controversial topic of delaying Medicare Part B till later and accepting the penalty if you ever had to come back on it as a federal employee. Why would we consider that? Well, the big question is why pay for an extra $2,000 to $2,500 per year to add on Medicare Part B with your FEHB when your FEHB already provides really good coverage? That's a great question. So, f- to understand that scenario, we have to understand the psychology that goes into every federal employee when faced with this decision. At 65, if you're retired, you have a 7-month window to sign up for Medicare Part B. At this point, if you decline coverage, you're going to have a 10% penalty for every 12-month period that you wait. That lasts as long as you have Part B coverage. So that's a permanent penalty. The only exception is if you're still working and have FEHB as group coverage, or your spouse is working and you have coverage under your spouse. This is a really difficult time for federal employees because they don't know what to do and they're faced with a pretty stiff penalty if they don't sign up. Now, when we look at the penalty on surface level, it seems very daunting. The basic premium for Medicare Part B in 2025 is $185. When you add a 50% penalty to that, right, at age 70, if you waited, you're talking about paying close to $300, right, a month for that same exact insurance coverage, which is Medicare Part B. If you wait 10 years and kick it down to at 75, you're going to pay close to 400 and then from there getting closer to 500. So at surface level, that looks like big penalties that you pay to get back onto Medicare Part B. However, when we think about the fact that there are many federal employees that decline Medicare Part B. Why? They have super strong FEHB coverage, right? They've had comprehensive benefits throughout their career. They those benefits don't stop. They continue into retirement. Interfacing Medicare Part B with FEHB provides a great wraparound coverage for no expenses. How out of pocket costs. However, there's a cost to the Medicare Part B insurance, right? And that's the 2,000 to 2,500 bucks annually at the basic rate. Keep in mind there are some reimbursements for FEHB plans to reduce that cost, but there's still a cost. And additionally, folks that have great health may not need two insurance coverages, right? It may be unnecessary to double that up. So we did a study and we wanted to actually see if someone started Medicare Part B at $185 a month, adjusted for inflation, was 65 today in 2025, their cumulative cost, not including reimbursement, would be just shy of $80,000 that they would have paid into Medicare Part B over a 25-year retirement. That's assuming age 90 is when they lived until. Now, notice if someone were to delay until 70, which in this case is 2030, the cumulative costs would be just shy of $100,000. The cumulative cost for delaying until 2035, 10 years, would be just over 100,000. But notice how delaying until 2040, 15 years, starts to drop that line lower. Why? Because there's 15 years that this person goes without paying. So if we start to consider the fact that there's a bend down effect, that the penalty actually flattens over time, right? Because if we look at the fact that there's fewer payment years in that scenario with 15 years, it shows that this person could actually come back into Medicare and not get hit with this drastic cumulative cost because they had 15 years of not paying into Medicare Part B that they saved. Additionally, these premiums do rise with inflation, so they're saving on those higher premiums, right, for those 15 years. And it's a fixed percentage, right? The penalty doesn't compound like interest. It's a set fixed rate that fades over time. So let's look at this even closer. Now let's look at this broken down annually. Okay. So again, the average federal employee that's on the base premium for Medicare Part B will pay around $3,000 per year. However, if the same federal employee delays coverage and picks it up at age 70, they will pay $3,800 per year for that same coverage. Delayed by 10 years, $4,000. Delayed by 15 years, $3,500. Do you see the bend down? This is assuming a 0% savings rate. If we pumped in a savings rate here, these numbers would actually improve on the delay. Now, the reason we didn't assume a savings rate is because FEHB gives you a reimbursement, right? So we want to be fair here. There's a reimbursement that most FEHB plans give back. Blue Cross Blue Shield does 800, Aetna does 900. This is when you elect to go from standard to basic. But there also is a time value of money that's not thrown in this calculation. But the point is, it's not as bad as one would think if you had to come back onto Medicare Part B. Because most people are in decent health now. Their worry is that in the future, they have to come back. They're going to get slammed with these higher costs. But when you average that out over time, it's not as bad because of the savings that went in not paying for those 5, 10, 15 years. So, really, this is the idea, right? The considerations before we decide is we got to think beyond next year's premiums. We've got to consider the long term medical needs. We got to also think about FEHB together and the wraparound coverage that provides, because let's be honest, if you get both, you're going to have no out of pocket expenses. If you only are on FEHB, right, you're going to have those co-payments, those deductibles, those other things that apply, but there's also max out of pocket limits on those insurance plans if you stay within network. Now, if you go to a network, this is where you can get into trouble. Additionally, if your plan would be to get on the Medicare Part B later, enrollment timing could be an issue, right? You can't just enroll in Medicare Part B whenever you want. That's usually around November. So if you had a condition that warranted wanting to get that Medicare Part B insurance back, you might have to wait. Also, the future premium increases of your required distributions on your retirement accounts can affect what you pay. So that needs to go into the decision making because those premiums are large, right? If you start making more money in retirement. And keep in mind, a lot of federal employees have more income in retirement because their required distributions kick in their early to mid 70s and put them into these higher Medicare premium brackets. That's one thing that we can forecast and make sure that that is an amount that you feel comfortable with before you get on the insurance. Okay. So, lastly, before you make your decision, understand the numbers. Understand what exactly you're paying for. What are you getting? What is going to be your starting off Medicare base premium when you get in? But where are you going to be paying in your mid 70s when your required distributions kick off on your TSPs that are treated as income? Those are things that we can help you with. Those are things that are offered in our retirement readiness meeting, which is a offering that you can either go on our website or take your phone, scan the QR code on the left. That will give you access to a registration page. If you're just looking for content on our YouTube channel, subscribe to our channel. It really helps the algorithm by liking these videos. We are trying to come up with new creative content all the time to get the juices flowing. It's not just a one and done decision on Medicare. We really think there's a lot of factors that go into play. This is one of them, trying to give you a different angle to the decision, and hope this one helps. If you've got questions, please let us know.